Wash your hands regularly with soap and water. Some parts of this country, water is a rarity. You cannot even afford this soap we talk about. Daktari, this clearly has also created a gap amongst the population because there are some who say, hatuna maji na tuko sawa tu. What is the impact of this inequality, so to speak? Professor Oyugi.
Sure,
yes,
sure.
yes.
I thought you were going to say professor. When you said doctor, I got a little bit. I thought
Okay.
my colleague here. So it is true that things like water are not evenly distributed in this country. Leave alone in the country, even in Nairobi itself. If you come to Nairobi, water is a big problem. Go to the slums. Everyone has to buy water. With little earnings. If you earn like 100 shillings in a day, and you have a family of 10, children, between water for washing hands for COVID-19 and water used for cooking in the house, what will you go for? So again, such resources are not equally distributed in this country. But what I wanted to say, just to add on to what my colleagues here are saying, is that even in places where there is water, I have seen people have now stopped washing hands. There are residential areas where they had tanks with water. If you are getting in, you had to wash your hands and get in. Nowadays, they have stopped.
They even covered in dust.
Yes.
Yes. Yeah.
Yeah. So people are slowly changing back to where they used to be. People are getting this false notion that COVID-19 is no longer there. And so they are not washing hands. Actually, washing hands is one of those interventions that people have completely stopped for now. It's only being practiced in very few places. Then the next thing is wearing of mask. Also, since the president announced the lifting of the curfew,
yes,
you have seen people now think that COVID-19 is not there. A lot of people are even not wearing masks. So if you think about where we are now with COVID in terms of those simple interventions, we're actually backtracking. And we're backtracking at a time when a large population in this country have refused to be vaccinated based on the people you are seeing on TV with various reasons.
Yes.
We are doing this with very limited healthcare facilities. If we were to get sick, the way people are getting sick in Europe, we will not be having enough ICU beds to take care of these people who are sick. So we really need to sit down and go back to where we were at the beginning of COVID-19, when people were practicing those interventions. Right now, we have really backtracked on them as we speak.
Alan, affordability is such a huge thing. Water, soap, these masks we talk about. And some of the countries we have seen have been able to keep the infection rates low because they have these resources at their disposal. How can we bridge the gap going forward?
Thank you, Gladys. And to build up on what Professor Oyugi has said, it's important that we don't backtrack from the basics, wearing masks, washing hands, keeping social distance, because we are not yet out of the woods. But I would want to say the countries that have invested in health, they have prioritized clean water, they have prioritized access to nutritional food of good standards, they have invested in housing, they have invested in social protection, are the countries that are thriving in the COVID period, because these are the things that people need to be able to survive during a pandemic. And because some of these things have not been made available, people have developed a level of fatigue because they need to address their socioeconomic needs and they need to be able to get out and to be able to do so. And so by the government not having a cushion for these issues, then that is what is causing a gap, because people need to go out and fend for themselves and they feel the lockdowns, the movements are restrictive on their day-to-day lives. Now, what is important, given that now we are getting into the theatrics of politics, would be to understand whoever is running to be the next head of state, what plan do they have to make some of these things an actual reality? Because COVID has exposed the inequalities that exist among us in this country, the inequalities in the health system, and any serious person who wants to lead this country should be telling us what is their plan to do so when they get into power. Because if we're going to make health services affordable, available, acceptable, and of good quality, then we must look at the right to health from a holistic perspective. It's not just about building hospitals and putting people on treatment. We should be thinking about how do we have less people visiting the hospital because they are living a healthy lifestyle, and what has our government, either at the national or county level, done for that to be able to happen. And just lastly, on what Professor Oyugi said, that if we continue to go in this direction of not following rules, our health system is going to be overwhelmed, which is extremely true. But the counter question is, the ICU beds the counties were to put in place, the ICU beds the national government was to put into place, the funding they got from World Bank, from Global Fund, and then even other coffers, what exactly did they do? As I sit here as a civil society representative, we don't have a clear perspective that the investments that came in, did they actually strengthen the health system, or did they turn people into COVID-19 millionaires? I think that's a pertinent question that needs to be addressed, because if we can't use the COVID pandemic to strengthen the health system, and that not includes infrastructure, but human resources for health, then we're not going to get out of the woods from any other